Good morning or good afternoon. Welcome all to Keeping Our Babies Safe, Working Together to Reduce Sudden Infant Death, SUID webinar. This webinar is presented to you today by the National Institute for Children's Health Quality and Safe Kids Worldwide. So we are in partnership today. We're bringing together Safe Sleep champions to discuss the challenges, to share ideas, and to really dive into what we can do to prevent sleep-related infant death. So you'll hear from a variety of speakers from all across the country today, and we know that you all are joining us from across the country as well. I see you all are beginning to put that in the chat, so continue to roll call in the chat and just stay engaged. We ask that you ask us questions in the Q&A box, that you can keep your conversation going, reactions, and share your thoughts in the attendee chat, and that we really just stay engaged and have a wonderful conversation today. So with that, I would like to introduce Dr. Stacy Scott, who's going to facilitate us and lead us in today's webinar.
Well, thank you, Ms. Davis. We appreciate it. Welcome, everyone. It is so of the type of engagement we've gotten since we made this announcement, and we are working very hard in making sure that we deliver. And with that, I want to tell you and talk to you again about joining the Keeping Our Babies Safe, Working Together to Reduce Sudden Unexpected Infant Death. And a little bit about today's agenda. And again, we want to cover three main points: why infant safe sleep education is important, the strategies for communities committed to preventing infant sleep-related deaths, and what's next, the National Community Partnership to Promote Safe Sleep Initiative. Also, we want you to take a moment to, as we go forward, to look into our chats, the other resources. You'll see our presenters, bios, and what the great wealth of knowledge they bring to us today. And we also encourage you to subscribe to our Community Engagement Hub, which will have a lot of resources that supports a lot of things that we will be talking about today. So with that, we can move, I believe. So going into why infant safe sleep education is important, if we can go on and continue. And basically, I want to start out by talking about the impact of sudden unexpected infant death and the unimaginable hard families that we work with experience across this country. We know that every should not die, well, at least healthy babies should not die before their first birthday. And also, despite of all the work that we've been doing for decades that you'll hear about today on the call, we know that sudden unexpected infant death still does persist, and in many times and often in communities of color. As we also look a little bit more, just not giving a whole lot of background in regards to how we really define it and things of that nature, because we will be doing that on our next webinar, but we wanted to give you just a high level about sleep-related infant death and why this particular webinar is so important. So we definitely want to mention the work of the Academy of Pediatrics and looking at their last recommendations they made in 2022, which really gives you a whole definition and again, analyzing why it's important to promote safe sleep and gives you a lot more detail. So we strongly encourage you to look at this particular policy statement, which again, we will have available as a resource after this webinar. Next slide, please. And so just giving you a little background, what is sleep-related infant death? And so it's a sudden unexpected death, infant death that occurs during an observed or unobserved sleep period, most often in sleep environments. We see that there are about 3,500 deaths that happen due to sleep-related deaths. And we see another one that was a major issue when this whole campaign started, which was SIDS, which is sudden infant death syndrome. Ill-defined deaths and accidental suffocation and strangulations in bed also fall under the sleep-related infant death. Sleep-related infant deaths encompass an unexplained sudden death in infants, SIDS, as well as in accidental deaths. So when we talk about sleep-related infant deaths, we hear we hear people use, as they say, SUID, which really stands for sudden unexpected infant death. These deaths of an infant of younger than 1 year of age that occurs suddenly and unexpectedly is really the umbrella of all of the things that we're talking about that falls within sleep-related infant death. Next slide, please. And so when we talk about sudden unexpected infant death, what does that include? These are deaths without a clear cause, as I mentioned before, under that category. Half of the SUID cases that we refer to fall under sudden infant death syndrome. We have a death from a known cause, such as suffocation. We see that many of these deaths are due to accidental suffocation, but disease and sometimes other things can also be a purpose for a baby to die suddenly and unexpectedly. And also, after a full investigation, which includes an autopsy, a death scene examination, and a clinical history review, really is when this is determined as a sudden unexpected infant death. We used to say back in the day, and still many people say, that it is really a diagnosis of exclusion. If you cannot find any other reason an infant has died suddenly and unexpectedly, it could be categorized as a SUID death. Next slide. So, what else do we know? That there are some persistent racial ethnic disparities. We know that sleep-related death, like other causes of infant mortality, really are very notable and persistent when it comes to racial and ethnic disparities. We know that mortality rates for non-Hispanic Blacks and American Indian Alaskan Natives, although have decreased, they're still very slow in doing so, and we still see a widened gap within the disparities. The other big thing is that we look at the difference between the prevalence of supine positioning and other sleep-related infant environments, which really people putting their babies on their stomachs, also putting them then in environments that may not be considered safe for whatever reason. And again, we want to bring into the whole piece around culture and things of that nature. So again, these are so important on why we are doing this education, to really be able to see and work with different populations that also have issues that can contribute to these disparities. Next slide. So what from communities committed to preventing infant sleep-related deaths? We can go to the next slide. And so I am honored to have Dr. Yvonne T. Maddox, who was the president and chief executive officer of the T.A. Thornton Foundation and the former deputy director of the Eunice Kennedy Shriver National Institute of Child Health and Human Development from 1995 to 2014. She was not able to join us live, so we have a recording of a conversation that we had that gives us a little history about some of the strategies at that time, as we referred to as NICHD, did in regards to this whole particular talk and outreach around a safe sleep, and also the connections with the communities that help us get the message out. So with that, we'll start that. Mm-hmm. Well, good afternoon, Dr. Maddox. It's been a long time. It's so great to see you, and I really appreciate taking your time out of I know. Well, good afternoon, Dr. Maddox. It's been a long time. It's so great to see you, and I really appreciate taking your time out of your, I know, still busy schedule to join me today.
My pleasure. It's my pleasure, Stacy. It's great to see you, and this webinar is so important and it's so timely. Sorry that I can't be there live on the 26th, but anyway, I appreciate your making time for me to tell you a little bit about what I think about the program and its future.
Well, thank you so much. And so, you know, I don't have to tell you, April 1st, there was a big announcement that the Eunice Kennedy Shriver National Institute of Children's Health was closing down their communications office, which housed the Safe to Sleep campaign. And so there's been a lot of conversations around where do we go from here and the importance of continuing this work and education. And so we thought that we would put this webinar together to really talk about a little different from many other people about the impact of community and the role community can play in continuing to get this message out. While everybody's trying to figure out what's going on, I know that we take it to all of the families in the communities that can help share this message. It's so important. And all I could do is think about us and the years back, late 90s and early 2000s of the work that we did with a lot of community-based organizations. And I wanted to take this moment to kind of reflect on that. And I understand that, you know, you started as the deputy director at NICHQ in 1995, and you went to 2014, and you were instrumental in a lot of things. But the one thing I want to focus on is the work that you did around Safe Sleep, also known as Back to Sleep, back in the day. So you want to share a little bit with that?
Yes, well, again, let me just express how excited I am about participating in the webinar today and having a chance to talk with you. Yes, as you recall, when I came to NICHD in 1995, the Back to Sleep campaign had started. It actually started the year before in 1994. And at that time, sudden infant death syndrome was the leading cause of infant mortality during the time. In fact, it was not only the leading cause, but we also saw that during that time, there was a grave disparity in infant mortality generally between the general population, meaning in this case, the white population, and the Black community. So what we wanted to do was to see if we could put together a campaign to engage the community at large, because it was clear that perhaps the African-American community was not getting our messaging. So the American Academy of Pediatrics was a strong backer of the Back to Sleep campaign, and it was good to have the collection of pediatricians behind this movement. And the thing that was also critical during that time is that we had strong administrative support for reducing infant mortality and back sleeping. During that time, our president then was President Bill Clinton, and our secretary was Secretary Donna Shalala, the longest lasting Health and Human Services Secretary ever. And she was very, very much behind trying to reduce infant mortality. And she recognized in 1999 that there was this grave difference in infant mortality and SIDS deaths between the white population and the African-American population. So having the backing of the director of the NICHD at that time, we were the National Institute of Child Health and Human Development. But by the time I left NICHD in 2014, we were then called the Eunice Kennedy Shriver National Institute of Child Health and Human Development. But Stacey, during that period from 1995 to 2014, we saw a 50% reduction in infant mortality rate as a result of the work that the Back to Sleep campaign had leveraged. But we were still seeing, as you know, throughout that period, this disparity between African Americans and white babies. So we put together a collaboration of many partners. And of course, having mentioned to you earlier about Dr. Shalala being our secretary and promoting this, she called on Tipper Gore, who was the vice president's wife, to serve as a spokesperson for the Back to Sleep campaign, and called on our own dear David Satcher, who was her Surgeon General who went out on the waves and gave messages about the importance of sleep environment. But the greatest partnership we had were the partnerships that we had between the community members. And we launched this African-American partnership to reduce the risk of SIDS. And this partnership was made up of the Alpha Kappa Alpha sorority. It was made up of the coalition of 100 Black women, the women in the NAACP. And of course, you were actively involved in helping us put this group together. And the value of this group was not only that they were used to being in the community and reaching the families and the members of our Black community that we needed to reach to get the messaging out. They knew how to do it, and they were trusted in the community. So we as researchers and scientists and administrators, federal administrators, could use them as the conduits to get these messaging out. And we wanted it to be around the country. So we chose these three organizations who decided that they were going to have regional summits. Mm-hmm. And they had a summit in Tuskegee, Alabama. This was the first one, and it was led by the Coalition of 100 Black Women. Yep. The second one was in Los Angeles, and it was held by the women in NAACP. And then the AKAs had theirs in Detroit. And it gave us a range of geographical areas. But as you well know, even though the SIDS rate during that time, and of course we were talking about SIDS then, not SUID as we are today, but it was, quite frankly, in 2012, just about the time that NICHD became the Eunice Kennedy Shriver NICHD, that we began looking at the safe sleep environment as opposed to just giving the messaging of back sleeping. But it was the community who led us in that direction, quite frankly, because I never forget the focus group meeting that we had back in the early 2000s. And I think you led that focus group, or if you didn't lead it, you were one of the leaders of the group. And we brought in the community advocates, and many of the organizations that I just mentioned were represented. And they helped us really frame not only the Back to Sleep campaign, but the Safe to Sleep campaign, because they felt that we, the community at large, and particularly the African-American community, was educated and they were intelligent, and they would understand that SIDS was not something that we could put our fingers on and say exactly what's causing it. But if we could talk about the areas that could reduce the risks of SIDS, then tell them that. And they were the ones who came up with the messaging and the slogan that said, put children on their backs to reduce the risk of sudden infant death syndrome. That was their slogan, because we kept talking about back to sleep. And they said, Dr. Maddox, that sounds like you were advertising for a mattress or something, or you saying, go back to sleep, little girl. Go back to sleep, little boy. We want the full message. So yes, the community has always been strong partners with us. They also encouraged us to get the messaging on a lot of the communication strategy that came out from some of our industry partners. We were able to put the messaging on Pampers, on the Pampers Early Doppers. We're able to put it on the Gerber food products, mainly the rice cereal. We put the messaging on the backs of the Gerber cereals. So again, I can't tell you enough about how important the community is in this effort. And the community is a broad area. It's not just the advocates and the mothers and fathers and caretakers of children and babysitters, church workers, church leaders, but it is our administrative structure. It is our executive branch. We do need to have our administration and our secretary and our scientists all involved in reducing infant mortality and certainly reducing the risks of SUID.
Well, thank you for that. And I would be remiss if we did not mention one other partner, and that's the National Black Child Development Institute, and Evelyn Moore, who
Absolutely.
probably was instrumental in setting the stage for all the things that you talked about, and did a lot of work within their organization as well around championing this cause. I also want to talk about, and I know you were leaving, in that transition. But we did do another thing. We brought dads in the conversation and men. And we also had the opportunity to work with the fraternity, Kappa Alpha Psi fraternity. And we will be able to speak to a few people after us in this interview to talk about some of the work that they did. But it was amazing on their ability to be able to train so many men to go out and do education and target dads and uncles and everyone else. And we were able to train all of the new Kappas coming in.
Yes, you were.
And we, at that particular time, NICHD provided some funding to provide $1,000 mini grants to the chapters and also to the spouses of the chapters to do safe sleep education. I think we targeted about 55 projects across the country in both graduate and undergraduate chapters, as well as the Kappa Silhouettes, which were the wives. So another prime example, and I know many, not only just Kappa, but many organizations, even though the campaign officially ended with NICHD, continue to do the work. And we'll hear from them in a little bit about some of the work that they've been able to continue to do. And even beyond safe sleep, that they learned so much around that resource kit that we created, which was the Back to Sleep resource kit targeting the African American community, had how to do community outreach. We had tabs, a 15, 30, and 60-minute tab. We had sample press releases. We had flyers. They came in a nice little box. And at all of those summits you talked about, everybody left with a box to go back to their community to do that work. We actually got supported by another foundation at the time, which was CJ Foundation for SIDS, who put up, remember, $100,000 to support this initiative. So it was huge. And I think it really contributed to a lot. And that's what I want people on this webinar to know today, that you don't underestimate the power of the community.
Yes, and Stacey, you point out something else that's critical, and that is, the NICHD was a multi-billion dollar now federal agency. So we were able to get the resources prepared, get them printed, and have them available. But, we couldn't reach everybody, and that's why it was so important to have our partners and have the community engaged, because, if we gave out 100 kits, and those resource kits were important, or if we gave out 1,000 kits, they were magnified 10 times once we gave them to one of our partners, because the partners saw that these kits got around to the families, to the communities at large. And specifically, I love the idea that we were able to bring the dads in and to bring the fathers in and to bring the men in, because it's not just the dads and the uncles, but it is the men in the community. And the sorority had done a great job already with the AKs taking the leads, but the Deltas were involved as well. And then, of course, we had the Kappas. And working with the fraternities gave us a chance to realize how interested they were in health messaging. And we had not brought them in early on. And from that engagement with the SIDS and the SUIDS program, we were able to bring the Omega fraternity in to our efforts, because they were interested in helping us relieve what we see as very, very strong problems in the African-American community with depression and mental health issues. So they wanted us to launch a program called Brother, You're on My Mind. So we had the men who were working on SIDS and infant mortality reduction, and we had the men who are working on mental health and depression issues. So yes, it has been a broad community-based program. And as you know, NICHD was the first institute to actually launch this big community engagement effort. Of course, now community engagement and public trust and research has expanded across all of the institutes at NIH, and we're pleased that we work with them as well.
Well, as we close out, a question I leave with you as we move forward, as I walk in your footsteps, because you definitely were my mentor. What do you think that a role that we can play as an organization committed to working with communities, especially in this area? What are some things that you think that we can do based on the times in which we are in now?
Well, I think you need to not only continue to reach as many community advocacy groups as you can, but I just encourage you to try to use the community to help us better bridge the professional community. And I mean the doctors and the nurses and the caretakers and the public health servants who actually take care of mothers and children on a daily basis. Because you know that in order to get some of these health messages that research really has led us to discover and to make clear how important the safe sleep environment is, we still can't get the physicians and the public health providers really to understand their role in delivering the messaging. They need to deliver the messaging to their patients, to their mothers who come through for obstetric care, and help us do this. The advocates can't do it alone. If you've got the advocates giving one message and giving strong messages, but the professional side not giving any messaging, then it's sort of we're at adverse purposes. So if you could, in this very, very trying time, find a way to bring the community and the professional groups together around this question, because I'm fearful that the professional group may not be as active even as they have been, given the recent administrative decisions around funding of Back to Sleep, Safe to Sleep campaign.
Well, this is great. I mean, we currently are working on a project called the Community Centered Hospital Initiative that is doing just that we are positioning community organizations throughout several states to take the lead, to invite hospitals and professionals to come to their table and to talk about ways to improve birth outcomes and to reduce infant mortality. So I think we're on the right track, but of course, I always look to you and see exactly what else we can do and work together. This is the first of a series of webinars. We'll have 2 more, and definitely look forward to engaging with you again. And want to thank you so much for sharing your knowledge and giving us a little history about the whole Safe to Sleep campaign and our work to, again, reduce SUID now, as we refer to it, as sudden unexpected infant death.
Exactly. And stick with your plan, which has been also to target special states. You know, we've still got to work in Mississippi and Arkansas with a lot of effort, because they still are the leading states when it comes to infant mortality and, in fact, in SUID death as well. So it's my pleasure to have been with you this morning, and I look forward to the other webinars, and I hope my schedule will allow me to listen in.
Thank you so much. Thank you.
You're welcome. Bye-bye.
Well, what a wonderful discussion, and we're going to keep it going. We got an action-packed agenda, and so now I have the opportunity to bring on and introduce Ms. Wanda J. Montgomery, who's the President Emeritus of the Black Child Development Institute in Wisconsin, which is part of the National Black Child Development Institute overall. And I'm going to start out with a question for you, Ms. Montgomery, and that is, what impact did NBCDI and NICHD collaboration have on how the chapters, like your chapter there in Wisconsin, connected with families and began to build trust around educating around safe sleep?
Well, thank you, Dr. Scott, and thank you for this opportunity to share. So Black Child Development Wisconsin probably came on the scene shortly after this campaign started. We were chartered in 1997. And at that time, I believe there was probably 30 to 35 affiliates across the country. And as you indicated earlier, Evelyn K. Moore was our founder. And one of the things that Evelyn always did was to really look at ways that she could partner with national organizations to help our affiliates across the country to do work in our various communities that would be not exactly the same, but have the same message, where we can deliver in our communities to have impact. And so the Back to Sleep campaign was one of the first things I know that our affiliate got involved in. And I think that's probably when you and I first met at a national conference. But what this campaign did for us as a new chapter or a new affiliate, it really provided credibility for us to be able to disseminate information about safe sleep, to be able to train, do train the trainer. I believe we had you come in at one point, maybe a couple of times, but we were able to get people trained locally that then could continue to share that information forward. So we would train childcare providers, we would train families, parents, we would train community leaders. And we didn't just do the training, but we were able to give them this resource that they could then keep it going, be able to continue to spread it forward throughout our community. And I don't know other people that may be on the webinar, but when you put in a request to NICHD that you need 200 kids, and in a week or so, you got these big deliveries coming. I mean, that we did not have to pay for. But we were able to get that information out. You know, we had the magnets, we had the door hangers, and I can't remember if there were onesies in this kit, but at some point we got onesies that had back to sleep on it. And people like to get gifts, but gifts that have meaning that can really impact the lives of our children. And at that time, we were one of the highest cities and states that had high health disparities as it related to SIDS. And so it provided credibility for our affiliate and certainly provided an opportunity for us to have inroads at tables within our community. The other thing I want to say that this campaign did for us is we were also able to get this added to our state requirements for childcare providers. They were required to complete the SIDS training before they could get their license. And so we were able to do that. And I think, I don't know if we charged, but it certainly gave us an opportunity to really get our name out, to increase our membership, and to be able to continue to advocate for reducing SIDS in our community.
Okay, well, thank you so much. We got an action pack. I could keep talking. I got other questions I asked, but what I'm going to do is I'm going to move on to Ms. Howard, and then if we have time, we can definitely come back. So
let me just add one thing.
Go ahead.
What we do right now, and it lines up. We have a hashtag. Our campaign is hashtag Saving Black Babies. So whatever that means to anyone, but for us, we start with the infants and build from there. So I'll let Ms. Howard come on.
Well, thank you so much for adding that. So y'all remember that hashtag? What is it? Saving Black Babies.
Saving Black Babies.
Saving
Black
Babies.
Saving Black Babies.
Fabulous.
All right then.
Hello, Stacy. Hello, all.
So, Ms. Howard, your group that Dr. Mattis was talking about, welcome.
It is great to have, as the Africans say, a 4-eye meeting, and to also uplift some of the women who are not here with us today, who is so instrumental.
Yes. So I want to talk a little bit about that. So given the leadership and uniting these national Black women back in the day, how did you mobilize and support for safe sleep and infant survival? And what's needed now to continue that movement in our communities?
Well, in light of the fact that NICHD's communications division is not existing, I think this is a fact that most people don't know. The Back to Sleep campaign would not have occurred but for Dr. Yvonne Maddox having the courage to be a real courageous researcher and understanding that scientific information had to get to our communities. So in a small place in Atlanta, we designed this. And it wasn't just for the Black community at that time. We also went to the Pueblos, as some people may remember, and the indigenous people and the Latine. And the key to this work was that we had to be culturally fluent. Now, specific to the African American community, I had the privilege of being the first vice president of the National Coalition on 100 Black Women. That was the programmatic area. We focused on all things reproductive health and how in the world could saving our babies not be part of reproductive health. And then I reached out to the traditional organized Black women. Culturally, Black women lead wellness in our communities. They also lead wellness in the Latina community. When you get to the indigenous community, you also have to have the spiritual component. However, the National Women of the WIN, WIN, of the NAACP, led by not only a former vice president or national president of Delta Sigma Theta, but also the president of the National Women of the NAACP, coupled with Alpha Kappa Alpha and Delta Sigma Theta. But the three that heard the call first, Alpha Kappa Alpha and the Women of the WIN. And I am a Delta. However, those were the three that called first. And in that call, we met you and Dr. Maddox had the conviction to say, okay, how do you see it? And literally, Stacey, you recall, we were in conference rooms. I brought the magnet. I really hate that my screen is blurred. But this was the most time-consuming, and sweat equity went into this beyond all. Why? We were multi-generational in that room. And every woman in that room had input and experience about what messages we need to give simply to our community. No smoking, manage the temperature, stop having big baby showers with big fluffy things. You recall? I think we talked about big fluffy things and quilts for about 45 minutes. And then the big piece, how are you going to tell Big Mama the baby is not going to sleep on their stomach after you burp them? That's what we talked about. And to this day, the behavior modification and the prevention message is the same. So how did we do it? You know, we informed, we educated, and we activated. Culturally, what did we do? We went to organized experts, community experts. And each one of those locations we went to, the Deep South, the Midwest, and the West Coast, to this day, LA is still seminal in all disease and wellness. Detroit, still seminal, all disease and wellness. The South, the same. What I would tell you today that is needed is to understand that when we did the Back to Sleep campaign, our technology hadn't advanced to where it is today. People are on information overload. So we must constantly and consistently reintroduce wellness messages and prevention messages to our community in a culturally appropriate way. And lastly, I would say, to quote Audre Lorde, if there's no community, there's no liberation. So we must bundle the things together that make wellness. It's not by chance that you should not have a baby smoking around your crib. And smoking cessation is still important. So if Black people want to be well, I think it is incumbent upon us to create messages that bundle wellness together. We don't have the luxury any longer to take individual dis-ease or individual occurrences. And so everyone on this call, or excuse me, this Zoom, if you're passionate about wellness in your community, you must look at that community and understand how the community is informed, how the community would like to learn. And once people are informed and they learn, they will activate.
Thank you very much. Thank you so much. It just brings back so many memories, and looking at this picture, and we're traveling around and the bus is pulling in and all of that. So thank you for sharing this.
I hope people know I was the grasshopper, right? Because you have there the past bachelors of Alpha Kappa Alpha. You have there the former president of Delta Sigma Theta, the former president of the National Council of Negro Women, the former president of the Women of the NAACP, and you have Dr. Yvonne Maddox, my role model and my mentor to this day, who actually was the only Black woman to ever serve as the acting director of NIH. We must keep our history moving forward, and we must also encourage our sisters, Latina, Indigenous, and the majority women. Black women have been the wet nurse for the planet. We lead wellness. Let's all come together and collaborate. on the wellness of all of our children and our family at these very challenging times. And Stacy, you were the hub, and we can never say not enough. You were the hub, and we were all spokes. So do not get tired, my sister, and call on the National Coalition of 100 Black Women, call on the Black AIDS Institute, and call on me anytime you need me.
Well, I appreciate it. Thank you so much. Thank you. And now we're going to move. This is a fast-moving thing. I mean, we could continue going. Now, I don't know if Mr. Battles, he was having difficulties joining, but we do have another Kappa as well. So I'm going to take a moment and see if Mr. Battles, I don't see him in per se. Go back, but I want to go back a little bit. I'm sorry. Go back to the previous slide if you can. Forgive me. I do want to just call him out. Mr. Battles was the 33rd Grand Pole Mark of Kappa Alpha Psi Fraternity, Inc. I reached out to him and said, Mr. Battles, you coming into this role, would Kappa be willing to take on Safe Sleep as an initiative? And without hesitation, he definitely said, no problem, Dr. Scott, we will do that. And so as a result, we were able to do so much. And so if we go to the next slide, I think it's kind of skipping around. So again, as Dr. Maddox mentioned, it's going around, go to the next one. Yeah, stay right there. What's going on here? Here, I got it. So basically what we did was with Mr. Battles is ask him to have a partnership with NICHD in regards to how we could bring men into the conversation and how that we can, again, have men to talk to other men, other fathers, and things of that nature. And we were able to do that. We trained a multitude of men. Part of the initiation of men coming into Kappa at that time was they had to be able to have some safe sleep education. And so with that, you can see here, we talked about, we enhanced the partnership. The other thing that NICHD do, provide some funding to support many grants. And as we mentioned earlier, that we provided to both graduate and undergraduate chapters, as well as to the spouses, the wives of Kappa Alpha Psi. And we did all kind of initiatives. And so what I'm going to do is I'm going to invite Mr. St. Clair to talk about some of the work that he did specifically in Ohio. Just, again, what it meant to Kappa overall.
Hey, Dr. Scott.
Hey.
Thanks for having me. So we really appreciated being part of that initiative early on. That mini grant actually got us started around infant mortality in Columbus for our Columbus alumni chapter. We were able to do some safe sleep and use that as a kind of springboard to get us started. And we were able to actually secure another grant with your help, thank you, with the state of Ohio and with Medicaid. So we were able to really keep this going from the beginning. One of our major kind of key insights was that the power of male representation is very important, right? Most infant sleep or infant mortality initiatives really focus on the mom, of course, but the dads or the uncles or the grandfathers are normally left out of that programming. And we saw that there was a missing piece there. So we hopped on it. If you could imagine, 10, 20, 30, almost 50 handsome brothers dressed in all red, right? Yes. Standing there together, strong, presenting safe sleep information to the community. Not only the women loved it, but also the men got behind it as well, right? They were able to see us in the community really presenting this education. They saw themselves in us and said, hey, we belong here. We belong at the table, kind of putting some of this education down. They were able to go back to their families and regurgitate that information around safe sleep and the ABCs of safe sleep. So it was really important and really impactful on how we did that. As we started to see that, we started to see, engagement in the community, and communities actually reached out to us, and we went all around the state of Ohio with Dr. Scott, kind of giving these presentations, not only to other chapters and training them to do it as well, but around the community. So I don't know if you want me to go into some of the scalable pieces that we had or some of the strategies that really worked.
Yes, definitely. I really, as you see, I put the slide here for Fatherhood Matters, because I know out of all of that work, it really turned into a whole new initiative that CAPA did and championed. And so love to hear a little bit more about that. Mm-hmm.
Absolutely. Absolutely. So, it started with the ABCs of safe sleep, and it was just education. And as the community really took heed to everything that we were doing, they said, hey, there's a big need for fathers. And we created a Fatherhood Matters program. Brother Nate Jordan was instrumental at doing all of that from our end. He's no longer with us, but he was instrumental in making that happen and putting that together. What couple strategies that really worked for our programming? One was we looked at everything that we were currently doing at CAPA, and we said, okay, all of the barbecues, the back to school backpack drives, even the parties, everything we were doing, we could incorporate education and the ABCs of safe sleep into those pieces. And that made it really sustainable for us as other partners were coming to the table saying, hey, can you incorporate this education into our events? And we were able to really partner with other partners. Two, we had dual purpose programming. So the first was to educate, right? Let's educate the community around the ABCs of safe sleep. But as you stated, Dr. Scott, we wanted to engage our men as well. So we created the Fatherhood Matters program, where they were able to really learn about themselves, learn how to be a new father, and get all of that out of the way. And then three, we had that grant money that really helped keep us sustainable, right? We were able to hire folks like Nate Jordan and a committee to really work all of this work across the state. So keeping those three pillars were really important to us.
Well, we appreciate it, and thank you so much for sharing. And then what we're going to do is move to Mrs. Battles, who at that time was the first lady of Kappa Alpha Psi, because Mr. Battles is her husband. And so she is a national, but also what she evolved into is becoming the national spokesperson for the Global Infant Safe Sleep Center, Change Your Tradition, Change Your Position, which was really targeting grandparents. And I know Ms. Battles was having trouble with her audio, so she's going to be off camera, but love for her. I have would love for her to be able just to share about her experience on why it was important to be able to talk to grandparents and non-caregivers based on what at that particular time and even now. Ms. Battles? Mm-hmm.
Hello, Dr. Scott. Thank you so much for having me. It's such an honor and a pleasure to be able to share with the audience regarding grandparents and safe sleep. You say, why is it important? Well, let me tell you. Okay. It is important because of the number of grandparents and great-grandparents who are caring for our grandchildren. This is so crucial, and I have such a passion for this. But we learned at that time that more than 2.3 million grandparents were actually caregivers for their grandbabies. And so it's crucial for us as grandparents, great-grandparents, it is crucial for us to have the knowledge and to be aware of safe sleep practices for our infants and to ensure that our babies are safe and their well-being, regardless of where the child sleeps or whose house he's in. Not only should the non-custodial parent be aware, but grandparents, older siblings, and I believe any person in the baby's caregiving community should be informed on safe sleep practices. Grandparents definitely have to be. It's important because of the way we learned and the way we used to put our babies to sleep. So it is important that we know the right way to put babies down. We understand that education on safe sleep creates a consistent, safer sleep environment for our babies, regardless of, again, the parents or whoever home the baby's sleeping in. Safe sleep is important. Parents, grandparents, non-custodial parents, all, but following safe sleep recommendations, we know can prevent many SIDS or sudden infant death fatalities. And so that's why it's important as a grandparent to know how to take care of our babies, how to put them to sleep, and to keep them safe. So, and that's what we did. That's what we did. And yes, believe it or not, it make a difference. Thank you.
Yes. You're welcome. And we definitely traveled across the country doing that. So thank you so much. So, yes. And you can see here is a wonderful picture of Mrs. Battles doing some education in the community. So again, this is just showing the importance of and who the messages are in delivering that message. So we can go to the next slide. And so what I is also our sponsor, Safe Kids Worldwide. It is, again, we want to thank them for the work that they have been doing in regards to Hanson Community Level. They too had a partner with NICHD, a partnership. And again, they are our sponsors here today. And so we love this partnership and look forward to continuing it for it to grow. All right, then let's go to the next slide. Yes, Ms. Battles. Go ahead, Ms. Battles. Go ahead. Mm-hmm.
Oh, I'm sorry. I wanted to share that Change a Tradition, Change a Position campaign with you, but I guess we'll come back to that.
Well, yeah, we get enough time, we'll come back. So we just, we just want to make sure we get through everything, and if we have an opportunity, we'll go back and revisit that. Yeah, for sure.
Please, let's do that. Thank you.
You're welcome. So with that, I just want to take an opportunity. You've heard a couple of names mentioned. A lot of the material that you see within the resource center that you have was produced by Ms. Carla Coleman, and then also Mr. Jordan, Nathaniel Jordan, was an intricate part in the CAPA's champion Safe Sleep, along with all of the work that he did in Columbus. And so I want to just give a moment of silence for them and honoring our fallen champions. Unfortunately, they both have gone and joined our ancestors since this. And if you could go to the next slide. Again, we want to mention and take a moment to recognize Ms. Carla Coleman and all the work that she did. Next slide. We want to share this opportunity to reach out and to thank Mr. Jordan for his commitment. And so with that, I want to talk a little bit about, again, what's next for us here as we move forward to build this initiative. What we aspire to do is to elevate the lived experience of family doulas and elders and leaders as central to shaping the message and policy and supporting systems. We want to promote culturally aligned practices. Our hope is to collaborate with all of you and our leaders and co-develop safe sleep practices that respect family tradition while prioritizing infant safety. Next slide. We also want to look at how we create a national learning collaborative, how we foster continuous peer exchange between community-based organizations and public health experts, and researchers committed to infant mortality prevention, and then also rebuild trust and infrastructure and to address the erosion of trust caused by sometimes that one-size-fits-all campaigns and restrictive funding policies by how we invest in grassroots solutions and with unrestricted support. And we will be webinars to address a lot of these things that we are working and moving to do. And so with that, I'm going to go to the next slide and pass it off to Ms. Davis.
Dr. Scott. So we just wanted to bring your attention back to the Community Engagement Hub. If you subscribe to our Community Engagement Hub, you'll receive the resources that we shared in our resource center. You'll be able to register for the upcoming webinars, and you'll also see some additional resources that you might not have seen today, so that can help you continue your work. So please subscribe to the Community Engagement Hub to stay tuned into the Safe Sleep Initiative. And then just wanted to bring your attention to, as Dr. Scott mentioned, our upcoming webinars. So the next webinar we have on August 28th will be focused on data. We're really going to dive deep into the data and help communities leverage that data when they're working to create unified messaging. So join us on August 28th for that webinar. And then we also have our final webinar that'll round out the series. Will be hosted in SIDS Awareness Month, on October 23rd, and we'll really get interactive with that last webinar. We'll be able to share best practices. You all will be able to share with each other some of your challenges and solutions and breakthroughs. So encourage you to register for our upcoming webinars to keep this conversation going. And lastly, as I mentioned at the beginning, we really want you to take this survey. So please take the survey. You can scan the QR code to take the survey. Let us know if you're interested in continuing receiving information about Safe Sleep, about our initiative and some of the webinars and what the work that will come out of the webinar. So please scan the QR code to take the survey and give us your feedback about today's presentation and about your interest in upcoming presentations. And connect with us. We are on LinkedIn, Facebook, Instagram. You will find the recording to this webinar on our YouTube channel tomorrow. So please follow us on all of the social networks that you are on, and keep the conversation going. We are excited to have so many Safe Sleep champions joining us today. So Dr. Scott, I turn it back to you and just thank you for joining us, everyone.
Right. Oh my goodness, we got it all in. I know Mrs. Battles wants to talk about changing tradition. We will have another opportunity for you to do that, I promise. But we wanted to try to make sure we made it within these 60 minutes, and we did. I just want to thank all of the guests, all of each one of you all. We've been together for time, and it's so nice to be able to pick up the phone and say, hey, can you come back? Can you join us? And so you did. You heard the call, you came, and I look forward to, picking back up where we left off a while back. I think it's a need. I thank everybody in the audience today, and even people who will be listening to this after this meeting, because many people said they were not able to attend, but please listen to the recording, please share the survey. It is going to help us determine on what direction we need to hear from you on what you need in your community to be able to, again, make a difference and also be able to save so many lives and look at a future. I think all of this work impacts all of that for all of us. So thank you so much and have a great rest of your day.
Thank you. Bye-bye.
All right.
Blessed. Thank you.
All right. Love y'all. Bye-bye now. Bye.
I think I saw like 1,400 attendees, just about.
Yeah,
and like
we
the
have
amount of emoji reactions,
14,
we're almost to 4,000.
Yeah, we have 1,432 at the highest number I saw.
Great.
Mm-hmm.
Wow. Congratulations.
Yeah.
So
all right then. We
thank
did it,
you,
y'all.
Cece, Sharon, Jay. Oh, just good work. We got it through. And people are excited about the next ones. I think